Good morning, everyone. I'm Sayukta from Beautiful Spotless Skin team, and I'm sure all of you must be keeping good health. You must have come across people, especially women, with brown color patches on their face or redness on their face. They seems like freckle, like spots forming large flat patches. These are chronic disorders known as melasma and rosacea. According to a study conducted across 4 Indian cities reveals that more than 80% of population present skin color heterogeneity on the face, irrespective of age and gender. This heterogeneity mainly results from hyperpigmented spot and melasma. Indian skin tone is more prone to pigmentary disorders. It occurs mainly in women, 90%, and 10% of males of all ethnic and racial groups. Around 20% to 30% of 40 to 65-year-old women present a facial melasma. These disorders can cause enormous social and psychological problems. Hyperpigmentation, generally ignored as sign of aging and often misunderstood skin condition. Sufferers have been misinformed about aspects of this very common hyperpigmentary issue. This can lead to frustrating setback in treatment. To avoid all these hassles and to keep you informed, today we are here to know about the importance and significance of sunscreen. So let's connect today with our skin expert, Dr. Pranita Dhillo, to talk on benefits of sunscreen, especially in melasma and rosacea. She is a consultant dermatologist. She is MBBS, DVL, DNB dermatology. She is practicing dermatologist in Rohtak. She owns her own aesthetic clinic at the heart of city, Medical Mall, Derma New Skin Clinic. Her areas of interest are clinical dermatology along with cosmetic dermatology. She has all kinds of lasers and her expertise to work on them. A very warm welcome to you, Dr. Pranita. It's a pleasure to have you with us.
Thank you. Thank you so much for the kind introduction.
So, doctor, we all know that, especially in the condition that we stay in, sunscreen is very, very essential. But still, the fact remains that 60% of population in India are still not using sunscreen as a regular thing, right? So, we would like to talk about more on sunscreen and how it can prevent us from various pigmentary issues, etc. But first of all, I would like to know why sunscreen is so important, why we need it regularly, religiously to apply, why it's so important.
Okay. So, see, I always tell my patients, and especially those with pigmentary disorders, that sunscreen is very important. It is the first line care you can take to prevent yourself from the harm of the radiations from the sun. We have sun radiations, which include ultraviolet radiations, UVA, UVB, and also the visible light. That is also very harmful for the face. So to prevent photo aging, to prevent sunburns, and also to prevent some of the skin cancers, we should use sunscreen regularly. Sunscreen is very important. It is the primary tool to prevent from harmful radiations of sun.
राइट तो सनस्क्रीन बहुत जरूरी है लेकिन फिर भी हम में से ज्यादातर लोग इसे अभी भी अपने डेली स्किन केयर रूटीन में यूज नहीं कर रहे हैं तो इसीलिए हम इसके बारे में इस पूरे सेशन के दौरान और बात करेंगे सो डॉक्टर मार्केट में अगर अभी हम देखें सो मार्केट इज फ्लडेड विद वैरायटीज ऑफ सनस्क्रीन हाउ डू वी चूज द राइट सनस्क्रीन
यस दिस इज वेरी इंपॉर्टेंट ये बहुत जरूरी है कि आप अपने लिए सही तरीके का सनस्क्रीन choose करें. For that you can consult your dermatologist and बस मैं एक आपको brief guidelines आपको दे दूँ जैसे कि sunscreen should be broad spectrum. It should protect you from UVB radiations, UVA radiations and the visible light also. For UVB radiation we have a SPF which is sun protection factor. It tells how much it protects from the UVB radiation. Minimum 30 SPF is essential for the Indian skin tones. Then for the protection from UVA radiations, we have PA rating. Minimum 3+ PA rating should be there. Then second thing, sunscreen should be substantive. Like it should be water resistant. Okay, because we stay in a hot and humid weather. A lot of sweating is there. So, sunscreen should be waterproof. And third thing, you should choose sunscreen according to your skin type. Like if you have a very dry, skin, you can go for creamy preparations. If you have oily, acne-prone skin, you can go for the gel formulation, something like that. And also according to your professions, like some are doing night shifts, some are working outdoors, so there the requirements are different.
Right. So we can definitely seek advice from a qualified dermatologist, and as per our skin type, as per our working condition, they can suggest us the best sunscreen. And definitely, if we go out, definitely we can go for these things that you just mentioned. Doctor, we always get to hear a lot about reapplication of sunscreen or how much sunscreen we need to apply. We would like you to shed some more light, क्योंकि इसको लेके बहुत बड़ा confusion रहता है, कितना sunscreen लगाना है, कब कब लगाना है, क्यों reapplication जरूरी है.
Yes. So sunscreen should be applied 15 to 20 minutes prior to the sun exposure. धूप में निकलने के 15 से 20 मिनट पहले आपको sunscreen लगाना है. Minimum from the tip of your finger up to this line. This is a 1 fingertip unit. This much you require to cover your face, and similar quantity to cover your neck. Okay. How it is to be applied? It is to be applied like dot dot, and with a gentle stroke, you have to dab it on your face. You don't have to rub it. Okay. And that's it. And if you are staying outdoors, you have to reapply it within 2 hours. Every 2 hourly, you have to apply it. And one more guideline is coming. They say that after application of sunscreen and after going out in sun, if within 1 hour you reapply the sunscreen, then the continuous reapplication की जरूरत थोड़ी कम पड़ती है. So layering also equally important है.
Okay, right. So these things do play a vital role in how effective our sunscreen is. So today we are talking about sunscreen and how important it is to apply sunscreen regularly, religiously. And as doctor was saying, sunscreen does not only protect us from the harmful radiations emitted by the sun, it also protects us from the harmful radiations from all other light sources, our laptop, our mobiles, the LED lights that we have at our place or at workplace, and even the heat from the stove, etc. So it's important to apply sunscreen irrespective of the fact that whether our sun exposure is more or not. तो हम घर के अंदर रहे, घर के बाहर रहे, बहुत जरूरी है कि हम रेगुलरली रिलीजियसली सनस्क्रीन अप्लाई करें. और जैसा कि डॉक्टर ने कहा, सिर्फ अप्लाई करना ही नहीं, उसे रेगुलरली और प्री एप्लीकेशन, ये सब भी बहुत इंपॉर्टेंट है. हम कितना सनस्क्रीन अप्लाई कर रहे हैं, ये भी बहुत इंपॉर्टेंट है. अगर हम सही से सनस्क्रीन नहीं अप्लाई कर रहे हैं जो रिक्वायर्ड क्वांटिटी है, तो शायद उस तरह से वो वर्क ना करे. बहुत अच्छी बातचीत सनस्क्रीन को लेकर हमारी डॉक्टर प्रणीता से चल रही है. डॉक्टर प्रणीता, आपसे ये भी जानना चाहेंगे, कई बार लोग कंप्लेन करते हैं कि after using sunscreen I feel very dull, or my skin looks very dull, or it looks very dark, or I start sweating a lot. So there are a lot of reasons for which people are not being able to use sunscreen regularly. So they have various complaints. How do we fix that?
Yes, this is also very important. Sunscreen एक ऐसी चीज है जो हमें डेली लगानी है. तो सनस्क्रीन ऐसा होना चाहिए वो जो लगा के अच्छा भी लगे. ये नहीं है कि बस मुझे लगाना है एंड चिपचिपी फीलिंग ना आए पेशेंट्स को. सो कुछ लोग कंप्लेन करते हैं कि आफ्टर एप्लीकेशन ऑफ सनस्क्रीन दे गेट देयर फेस डल. दिस इज बिकॉज ऑफ द केमिकल रिएक्शन of the sunscreen on exposure to the sun radiation. So for that case, first thing I would suggest, wash your face and reapply the sunscreen. Second thing, what you can do is you can moisturize your face first and then apply the sunscreen. Third thing, what all you can do is few sunscreens are available which contains antioxidants added in them, like vitamin C or something. Many of them are available, so you can opt for such sunscreen. One more point is there are two types of sunscreens. It is like physical sunscreen or a chemical sunscreen. This pigment dullness part is more with the chemical sunscreen. So you can opt for the physical ones, which contains either zinc oxide and titanium dioxide. They leave a whitish cast for like 10 or 15 minutes, which goes away. But then this irritation part and all, it is very less in physical sunscreen.
Right. But with physical sunscreen or many other sunscreen also, we get that white cast. We have seen a lot of sports person on field with those cast, that's okay, but on a regular basis we would not like to see that white cast on our face. और कई लोग इसी वजह से सनस्क्रीन यूज नहीं करते क्योंकि उनको लगता है ये व्हाइट कास्ट अच्छा नहीं लग रहा है। बहुत ज्यादा व्हाइट कास्ट ना भी हो तो भी वो बहुत इजीली हमारे स्किन में कई बार जेल नहीं होता, उसके लिए क्या करें डॉक्टर?
White cast पहले आता था. Like since nowadays the particle size of the physical sunscreens like zinc oxide, titanium dioxide, it is reduced to nano size. So the problem with the white cast is not huge जो पहले था. Second thing, you have to apply your sunscreen with gentle strokes and the adequate amount to be applied, that is also important. And still, if you feel that too much of white cast is there, you can wipe off the excess one and fix the remaining one with your compact powder or anything loose powder.
Right. So, Doctor, we are talking about sunscreen and the importance of sunscreen. Now, a very general question that people often ask is कि sunscreen तो sun से protect करती है ना, मैं तो sun में जाती ही नहीं हूँ, मेरा sun exposure ही नहीं है, I'm working from home. और मैं तो लैपटॉप या मोबाइल पे भी काम नहीं करती हूँ। आप कह रहे हो ना कि जो लाइट इमिट होती है वो भी हार्मफुल है। मैं तो मोस्टली किचन में रहती हूँ। व्हाई शुड आई यूज सनस्क्रीन? उसको लेकर आप क्या कहना चाहेंगे डॉक्टर?
Still, sunscreen is important, especially if you have melasma or pigmented disorder. Sunscreens are important even if you're indoors. That is okay. If you are indoors, you can use 30 SPF sunscreen. But if you're outdoors, then you have to apply 50 SPF or more. And for the second thing which you have asked, for those with the night shifts, those who are working on computers and all, that is more harmful actually, because computer, phone screen, it is very close to us. And the blue light which is emitted and the IR radiations coming from them, they are more responsible for melasma thing. For such patients, though, sunscreen is important. In fact, specialized sunscreens are available to protect our skin from IR radiations. They contains iron oxide, and they're called as tinted sunscreens. They are also available for such kind of issues. And cooking is not for housewives. Even the working ladies, they have to cook. So
Yeah.
during that time, lot of heat is coming, and that is also a time. It's ideal if you use a sunscreen, or you can simply use a cloth or something to cover your face, especially if you're undergoing any procedure or you're under a treatment for melasma or rosacea.
Okay, we'll also talk about melasma and rosacea a bit, but before that, because you said that anything above 30 SPF is okay for Indian skin tone, right? But the thing is, many people are so confused, and there are so many SPF available, SPF, sunscreens available in the market, starting from 15 to 20 to 30 to 50, 60, 70 till 80. I have seen sunscreens. Now, people have this general perception that the higher the SPF, the better the benefits. What's your stand on that, doctor?
See, there are 2 points. A lot of the OTC products, they only force on SPF, SPF, SPF. SPF only, it is only protection against UVB radiation. And mind you, for the melasma, UVB is very less responsible. What is more responsible is UVA and IR radiation. So it's not only SPF which is important, it is the PA rating which is important. And if you are working in a night shift, then other tinted sunscreens and all that is important. This is the first thing. So don't look only for SPF, look for the PA ratings and other things also. Second thing, for the SPF part, see, if minimum 15 SPF, it protects around 93%. 30 SPF, it protects around 97% from the sun radiations. And 50 SPF, it protects around 98%. So it is just a matter of 1 or 2%, but every bit of percentage protection is important, especially if you're working outdoors, if you're working in a duration of 11 a.m. to 4 p.m. when the sun is on the top. It is very important to apply 50 SPF sunscreen. It will give you more protection. Second thing, we Indians tend to apply the sunscreen inadequately. And if you are using a higher SPF sunscreen, that inadequacy of the cream application, that will be taken care of by the higher SPF. So I would recommend for those who are working outdoors, it's important to use a 50 SPF sunscreen. For indoors, 30 is enough.
और इसीलिए आपने इनिशियली कहा था कि सनस्क्रीन डिपेंड करता है कि आपका स्किन टोन कैसा है, स्किन टाइप क्या है और आपका वर्किंग कंडीशन क्या है, हाउ मच इज योर एक्सपोजर अंडर द सन और अंडर वेरियस गैजेट्स एक्सेट्रा। तो इसीलिए इन सब चीजों को कंसिडरेशन में लाके ही हम एक परफेक्ट सनस्क्रीन लेते हैं और इसके लिए हमें मदद करते हैं एक क्वालिफाइड डर्मेटोलॉजिस्ट। सो व्यूअर्स, प्लीज गो एंड कंसल्ट क्वालिफाइड डर्मेटोलॉजिस्ट in case you are still not using sunscreen as a regular thing. Sunscreen पर हम बात कर रहे हैं and as we have been continuously saying कि melasma and rosacea में sunscreen एक preventive measure के तौर पे भी डॉक्टर काम करता है और एक ट्रीटमेंट के लिए भी sunscreen का यूज होता है। तो हम चाहेंगे कि आप थोड़ी बात melasma and rosacea in view of sunscreen भी करें।
जी, मिलाज्मा, इट इज अ मिलाज्मा कोएज्मा या फिर हिंदी में उसको झाइयां भी कहते हैं। इट इज अ वेरी कॉमन स्किन कंडीशन, वेरी कॉमन। इट यूजुअली इन्वॉल्व्स दिस malar area of the face, this butterfly shape. It may involve nose, upper lip, above the eyebrows, depending on the severity. इसमें मोस्ट इम्पॉर्टेंट है सनस्क्रीन का यूज करना, बिकॉज इट इज इंक्रीज्ड इफ यू आर, अगर आप सन एक्सपोजर करते हो तो। And there are many other factors also for its causation, like vascular factors are there, hormonal factors are there, but major role is sun exposure and the visible light exposure, the blue light which is coming from our phones and screens and all. So that protection is important for melasma. And other treatment modalities are definitely there, like depigmenting creams like kojic acid, arbutin and all. Will not touch on that. And second condition you were asking about, rosacea. Rosacea is a condition where the skin gets very sensitive. The sun exposed part of the face, the red colored patches, sometimes papules or pustules, they cover on the exposed part of the face. In such cases, I would suggest rather than going for a chemical sunscreen, you go for the physical sunscreens so that the irritation part will be less.
Right.
And other treatment modalities like don't be harsh on your face, no harsh face washes and the things are there. But sunscreen, sun protection is important. And yes, other than this primary protection by sunscreen, the physical protection by your clothing is important, like wearing the broad hem hat, broad brim goggles, hats, and cloth, especially during 11 a.m. to 4 p.m.
फेयर इनफ। तो सनस्क्रीन तो हमें यूज करना ही है, साथ ही जो फिजिकल सन बैरियर्स है, जैसा कि आपने कहा, हम एक स्कार्फ कई बार लगाते हैं, ब्रॉड ब्रिम सन ग्लासेस है, ब्रॉड ब्रिम हैट्स है, कैप्स है, उसका इस्तेमाल भी करते हैं, वो हमें एडेड प्रोटेक्शन देता है सन से। मेलास्मा एंड रोजेशिया से रिलेटेड एक क्वेश्चन हमारे व्यूअर्स ने भी पूछा है, वो भी मैं आपसे पूछ लेती हूँ क्योंकि हम उस पर बात ही कर रहे हैं। नित्या का क्वेश्चन है, कैन सनस्क्रीन हेल्प प्रिवेंट मेलास्मा फ्रॉम वर्जनिंग और न्यू स्पॉट्स फ्रॉम फॉर्मिंग?
Yes, definitely. If you're undergoing treatment for melasma and if your doctor has corrected your melasma up to like 70% or 80%, it is your prime duty to use sunscreen. Otherwise, the whole efforts of the doctor, they will go in vain. It is very important to use a sunscreen. If after treatment, after achieving the results, and if you go for like beach holidays and you don't apply sunscreen, it will come back. So for the reappearance of the new patches and for the maintenance of your previous treatment, it is first and foremost important to use a sunscreen and to keep using sunscreen.
Right. Sanjana का सवाल है, are there any specific sunscreen application techniques or tips for individuals with rosacea?
Like I already said, for rosacea, you don't use harsh face washes. First, ideally, you moisturize your face with the non-comedogenic moisturizer, and then you apply the sunscreen, ideally the physical one, so that the irritation part will be less.
Right. हर्षिता का भी सवाल हम ले लेते हैं, वो पूछ रही है कि मेलाज्मा और एक्ने अगर दोनों हैं तो क्या अलग अलग सनस्क्रीन्स यूज करना पड़ता है? और मैं ये भी जानना चाहती हूँ डॉक्टर, स्पेशली जो एक्ने प्रोन स्किन वाले होते हैं या जिन्हें एक्ने हो रहा है, वो भी सनस्क्रीन लगाने से बचते हैं, उनको लगता है और लेयर अप क्यों करें, पर क्यों एक्ने के केसेस में भी सनस्क्रीन लगाना जरूरी है?
सी, बहुत लोगों को ऐसा लगता है, इनफैक्ट मैक्सिमम लोगों को लगता है कि मुझे एक्ने हो रहा है तो मैं कुछ दिन के लिए सनस्क्रीन ना लगाऊं, बट दैट इज टोटली रॉन्ग. Sunscreen is very important. Even if you have acne, the only thing is you have to choose the right sunscreen. Reason being, acne is because the sun damage causes the inflammation, the free radical formation, and it will again worsen your acne. And the pigmentation part of the acne, it will also worsen if you do not use a sunscreen. So use of sunscreen is important even in acne and oily skin. The sunscreen to be used for acne form acne conditions is you can use a gel form sunscreens. And yes, that's it. The gel form sunscreen will be helpful.
राइट कई बार एक्ने ट्रीट करना तो ऐसा लगता है कि आसान है, लेकिन एक्ने की वजह से जो पिगमेंटेशन हो जाता है, जो स्कारिंग हो जाती है, वो ट्रीट करना ऐसा लगता है ये ज्यादा मुश्किल है. तो ऐसे में मुझे लगता है जैसा आप बता रही हैं सनस्क्रीन का इस्तेमाल करना ही चाहिए, बट हाँ, चूज द राइट सनस्क्रीन. नवनीत कौर है, her question is, can sunscreen alone effectively cure melasma or should it be used in combination with other treatments?
Yes. So it depends on the grade or the severity of the melasma you have. If in the initial phases, few ladies notice that the brownish thing is coming and going, coming and going, in those cases, the sunscreen will definitely help. In the initial first 6 months or like that. But if your pigmentation is getting darker and darker and permanent kind of, then you have to go for depigmenting cream also.
Okay, right. हम सबको पता है कि स्किन के लिए मॉइस्चराइजिंग भी जरूरी है. सबसे पहले तो क्लिंजिंग करना जरूरी है, मॉइस्चराइजिंग जरूरी है, सनस्क्रीन जरूरी है. कई लोग मेकअप भी यूज करते हैं, कई मेकअप यूज करना चाहते हैं और कई लोगों के लिए ये जरूरत भी होती है एज पर देयर प्रोफेशन. नाउ द थिंग इज, मेनी टाइम्स वी पीपल एज लेमन आर कंफ्यूज व्हाट शुड बी द ऑर्डर. पहले सनस्क्रीन लगाना है, फिर मॉइस्चराइज करना है, मेकअप लगाना है, उसके बाद सनस्क्रीन करना है. वी आर सो कंफ्यूज. वी वुड लाइक यू टू टेल अस डॉक्टर व्हाट इज द राइट सीक्वेंस, और मेकअप भी अगर करना है तो वहां सनस्क्रीन का क्या प्लेसमेंट होगा?
Yes, this is a right question. First, always you have to apply a layer of moisturizer on your face. Wait for 2 or 3 minutes. Then you apply sunscreen on your face. Again, wait for 2 or 3 minutes. Then you can go for your makeup. Okay. And एक और चीज इसमें आ जाती है, like few people after application of makeup, they cannot reapply the sunscreen. So in that case, we have a spray formulation of the sunscreen available. So just like for bridals and like that, you can go on your makeup, you can just apply your sunscreen spray and you're good to go.
Okay. Now let's talk about children, kids, और उनका sun exposure तो ज्यादा होता ही है. Their screen time, लैपटॉप, टैबलेट्स एंड मोबाइल फोन का स्क्रीन टाइम भी लगातार बढ़ रहा है. क्या सनस्क्रीन बच्चों पर यूज किया जा सकता है सेफली, डॉक्टर?
जी, सेफली किया जा सकता है, बट बिलो 6 महीने से छोटे बच्चों के लिए सनस्क्रीन नहीं यूज करना चाहिए, बिकॉज उनकी बॉडी की जो एक्सक्रीटरी सिस्टम है वो अच्छे से डेवलप नहीं हुई रहती है, एंड बॉडी का एब्जॉर्प्शन भी ज्यादा रहता है, परक्यूटेनियस एब्जॉर्प्शन सनस्क्रीन का. सो इट्स बेटर कि 6 महीने से छोटे बच्चों को यूज नहीं करना है. 6 महीने के ऊपर के बच्चों को आप यूज कर सकते हो, फॉर श्योर यूज कर सकते हो. Better to go for the physical ones rather than the chemical sunscreen. Reason being, the chemical sunscreen का absorption थोड़ा ज्यादा होता है skin से, physical sunscreens का इतना नहीं होता है. And for kids, definitely full sleeves clothes will be more helpful. But अगर इनको कुछ allergic conditions है, sun से allergies है, वो सब है, in that case you can use a physical sunscreen. Especially if they are playing in afternoon, if they're going to play or something like that.
Right. We would also like to talk about pregnant ladies or mothers who are lactating. More so because pregnancy में कई बार melasma होता है. और अगेन प्रेगनेंसी में हम टॉपिकल एप्लीकेशन की बात करें, ओरल पिल्स की बात करें, बहुत ध्यान रखना पड़ता है. तो प्रेग्नेंट लेडीज या लैक्टेटिंग मदर्स किस तरह से अपना सनस्क्रीन चूज करें, डॉक्टर?
Yes, this is also important because many of the pregnant ladies आ जाती है कि अभी मेरी झाइयाँ और बढ़ जाएगी, या फिर बहुत सी लेडीज को झाइयाँ प्रेगनेंसी में ही फर्स्ट टाइम नोटिस होती है. That is there. So sunscreen is important for them even if they are working or not working. But इसमें chemical sunscreen आप avoid करें अगर आप pregnant है और अगर आप अपने छोटे बच्चे को दूध पिलाते हैं तो, because उसमें कुछ studies हुई है जिसमें वो blood placental barrier या फिर मिल्क में भी आ सकता है. So आप जिंक ऑक्साइड, टाइटेनियम डाइऑक्साइड वाले फिजिकल सनस्क्रीन आप यूज कर सकते हो. See, अभी तक हमने जो देखा है फिजिकल सनस्क्रीन, they are more in a safer side rather than the chemical sunscreens. So
बिल्कुल।
in pregnant and lactating ladies also, I would suggest go for a good physical sunscreen.
ये बहुत अच्छी इंफॉर्मेशन आपने दी है, स्पेशली जो हमारे व्यूअर्स हैं उनके लिए, क्योंकि प्रेगनेंसी में या लैक्टेशन के वक्त बहुत ध्यान रखना चाहिए। और कई सनस्क्रीन्स पे मैंने देखा भी है, लिखा रहता है कि इफ यू आर प्रेग्नेंट और लैक्टेटिंग प्लीज रेफर टू योर डॉक्टर बिफोर अप्लाइंग दिस। तो इसलिए प्लीज अपने डॉक्टर से कंसल्ट कीजिए। मेलाज्मा भी कई बार बहुत कॉमन होता है प्रेग्नेंट लेडीज में, या पिगमेंटरी इश्यूज होते हैं। ऐसे में सनस्क्रीन तो जरूरी है, लेकिन कौन सा सनस्क्रीन यूज करना है, और जैसा कि डॉक्टर ने कहा, इन केस ऑफ डाउट फिजिकल सनस्क्रीन इज ऑलवेज बेटर। Now, there are also makeup products coming with SPF, doctor. Like we have foundation with SPF, compact with SPF, lipsticks with SPF, kajal, everything with SPF is available. Uh, uh, do we need to, I mean, they will protect us from the harmful radiations, or we still need a standalone sunscreen if we are using makeup with these SPF?
Yes, many of the products, cosmetic products are available which contains SPF, but it's better if you have a pigmentary condition. It's better if you believe more on your sunscreen, and on top of that, you can use your foundation and all. Or what you can do is you can mix your sunscreen half part with half part of the SPF containing foundation, and you can use it. Many sunscreens are also available, which works as a foundation, tinted sunscreens. They contains iron oxide. Various shades are available. You can choose the shade according to your skin color, and you can go for such kind of medicated sunscreens, which work as foundation also. There's also loose powder comes, the mineral powder. It
Right.
contains SPF around 50, and 50 is quite good enough. So you can use your sunscreen, and on top of that mineral powder. That will be additionally helpful, and it will solve the makeup.
राइट। अच्छा, इसी से मुझे याद आया डॉक्टर, कई बार जब हम लोग काम कर रहे होते हैं, या मतलब हम इस तरह की कंडीशन में हैं जहां पर बार बार फेस वॉश करना शायद पॉसिबल नहीं है, और आपने कहा कि सनस्क्रीन का रीएप्लीकेशन इज वेरी इंपॉर्टेंट। फॉर एग्जाम्पल, आई एम वर्किंग इन द फील्ड, और ऑफिस में भी कई बार इतनी मीटिंग्स हो जाती है कि आपको कुछ अप्लाई करना है, ठीक है, लेकिन जाके फेस वॉश करे इतना टाइम नहीं होता। तो ऐसे में रीएप्लीकेशन कैसे पॉसिबल होगा?
यस, ये भी इम्पोर्टेंट है। देखो, रीएप्लीकेशन तो जरूरी है, तो इसके लिए वन वे मैंने आपको पहले बताया। आजकल जो न्यू गाइडलाइंस चल रही है, आफ्टर एप्लीकेशन ऑफ सनस्क्रीन विद इन अ आवर यू रीअप्लाई द सनस्क्रीन, एंड जो लेयरिंग इफेक्ट उससे आएगा, उससे कुछ हद तक आप बच सकते हो दिन भर के बार बार के लगाने के उससे। Second thing, you can just apply on the similar face, just wipe it off with the tissue and you reapply the sunscreen. And third option is you can go for the spray formulations, which are easy to apply. These two,
Right.
3 things you can follow.
Okay. Many times whenever we are going out on beaches, etc., we, make it a point to carry sunscreen with us. But if we are going uphill, mountains में जाते हैं, तो हमें लगता है अरे वहां तो snowfall है, वहां थोड़ी ना सूरज है, वहां थोड़ी ना हमें कुछ दिक्कत होगी, या वहां तो बड़ी ठंड है, अच्छी वादियां हैं। So how important it is to carry a sunscreen or apply sunscreen when we are, on the mountains or uphill?
वहाँ तो और ज्यादा जरूरत है सनस्क्रीन की, because the sunlight is reflected there. So even in the cloudy condition, even in those condition also, you have to apply a sunscreen. Any sunscreen, and nothing particular ki you should use this only, that only. You can go for the simple sunscreen also, because there won't be a sweating and all in the uphills. You can go with your regular ones, but yes, application of sunscreen with minimum SPF of 30 is essential even in uphills, especially the exposed parts.
Right. Kirti है पूछ रही है, how does sunscreen specifically contribute to the fading or lightening of melasma patches?
It is directly related to the sun exposure. If you are applying sunscreen, you're just preventing your melasma is having the hyperactive melanocytes. It is continuously making that brown color ka pigment and all. If you protect it with the sun radiation, especially the UVA and the natural blue light, they will not get activated. And if they don't get activated, the pigment formation will be less. And second thing, the inflammation and free radical formation, that damage also will be less. So in that way, it helps in melasma. to increase or decrease the pigmentation.
Right. Pulkit का एक similar question है. Can sunscreen help prevent or minimize the development of rosacea flare-ups triggered by sun exposure?
Definitely. That's why sunscreen is first and foremost for rosacea.
टीना भार्गव का भी सवाल ले लेती हूँ. Is melasma and rosacea autoimmune disease?
Rosacea, not melasma. Even also not the rosacea. Very few studies are there that few conditions are in rosacea is there, but not the melasma.
Okay, right. हम नॉर्मली ये बात करते हैं कि अगर सनस्क्रीन लगाना है तो दिन में आपको लगाना है. आपने भी बताया कि रीएप्लीकेशन जरूरी है, लेकिन रात को इन जनरल कोई सनस्क्रीन लगाने को नहीं कहता. बट कई लोग हैं जो नाइट शिफ्ट्स में काम करते हैं, ऑफिसेस में जाते हैं, नाइट में भी उनका स्क्रीन टाइम होता है. दे आर वर्किंग ऑन देयर लैपटॉप्स विद एलईडीज एक्सेट्रा. तो ऐसे में क्या उनके लिए सनस्क्रीन जरूरी होता है डॉक्टर रात में?
यस, उनके लिए भी सनस्क्रीन इक्वली जरूरी होता है. जैसे कि जो दिन में काम करते हैं उनके लिए जरूरी होता है. उनके लिए इनफैक्ट रात वालों को ज्यादा जरूरी होता है, बिकॉज द लैपटॉप, द एलईडी स्क्रीन, इट इज वेरी क्लोज टू आवर फेस. द लाइट इज डायरेक्टली डैमेजिंग and the blue light is very important for the causation of melasma. So if you are having melasma and if you are working in night shifts, it is definitely important to use a sunscreen, especially the tinted ones, which contains the iron oxide. It will protect you from the infrared radiations. The modified sunscreen you have to use in this case. The regular ones won't help.
Okay, so for people working at night or doing night duties, sunscreen is equally important for you. आपने tinted sunscreen का जिक्र किया डॉक्टर. We hear it many times that if you have melasma, tinted sunscreens are very good. If you want that makeup wala look, tinted sunscreens are the one you should go for. Please shed some more light over these tinted sunscreens.
See, this tinted sunscreen, it is a new thing coming up. It is important for the melasma point of view, as it prevents from IR radiations. And yes, cosmetically also they look elegant. Few patients they say that after application of the tinted sunscreen, the skin looks darker. So the various shades are available for the iron oxide. Various shades are available from lighter to darker, and the protection is lesser for the lighter tones and lighter shades, and it will be higher if the shade is darker. So you can compromise on that thing, and you can go for the lighter shade.
Right. Many of our viewers are asking that we are housewives, we are inside the house, and plus our screen time is not that much high. Why should we use sunscreen? Plus, they are also suffering from pigmentary issues and melasma. तो इन पे आप क्या कहना चाहेंगे डॉक्टर?
अगर आपको कोई पिगमेंटरी कंडीशन नहीं है, आपकी स्किन एकदम सही है और आप इंडोर हो, आप स्क्रीन भी नहीं देख रहे हो, still you have to use a sunscreen if you want to age gracefully, because sunscreen आपका photo aging बचाता है. It is a very good anti-aging secret. So it is like that. ठीक है, आप रेगुलरली डेली मत लगाइए, आप री-एप्लीकेशन ना करें, बट वंस अ डे यस यू हैव टू अप्लाई सनस्क्रीन.
और अगर कुकिंग कर रहे हैं तो फिर और ज्यादा जरूरी हो जाता है?
और ज्यादा जरूरी हो जाता है. ऐसे नहीं कि कुकिंग से पहले ही आप सनस्क्रीन लगाए हो, बट यस ऐसा नहीं है कि मैं कुकिंग कर रही हूँ अभी मुझे सनस्क्रीन की क्या जरूरत है. कुकिंग में जो लाइट हीट आता है वो आता है. इट ऑल्सो एक्टिवेट्स योर मेलानोसाइट्स and inflammatory free radicals. So equally important to use a sunscreen. If not comfortable, you can just use a cloth if you are suffering from some pigmentary condition.
Okay. Doctor, you just mentioned that how by using sunscreen you can age gracefully. I have heard this many a times, people saying that sunscreens are the best anti-aging products. Do you feel the same about sunscreen? And if yes, then why?
Yes, definitely. See, sun rays जो होते हैं UVA है, इनमें UVB है. जो UVA वाले हैं, they penetrate deeper. They हमारा जो कोलेजिन और इलास्टिन है इस पे भी ये लूज कर देते हैं, कोलेजिन और इलास्टिन. इस कारण से स्किन थोड़ी लूज पड़ने लग जाती है, झुर्रियां जल्दी आने लग जाती है, रिंकल्स. एंड जो UVB है वो इन्फ्लेमेटरी कंडीशन कॉज करता है अपर लेवल पे. रेड पैचेस देता है, ब्राउन पैचेस देता है. सो यूवीए लोअर लेवल पे हार्म करता है, यूवीबी अपर लेवल पे हार्म करता है. सो अगर आप सनस्क्रीन यूज कर रहे हो राइट फ्रॉम अर्ली योर एजेस, सो आप ये वाला डैमेज बचा सकते हो. यू कैन पोस्टपोन योर, झुर्रियाँ तो आनी है, बट यू कैन पोस्टपोन दैट थिंग. यू कैन एज ग्रेसफुली. आजकल इतना सब हो गया है, लाइफ एक्सपेक्टेंसी बढ़ गई है. पहले से तो काफी ज्यादा लाइफ एक्सपेक्टेंसी बढ़ गई है. सो इट्स आवर ड्यूटी टू प्रोटेक्ट आवर स्किन एंड एज ग्रेसफुली, एंड सनस्क्रीन इज द फर्स्ट एंड फॉरमोस्ट स्टेप फॉर दैट.
और उस हिसाब से अगर हम देखें, क्योंकि हम कह रहे हैं कि सनस्क्रीन 6 मंथ्स के बाद से, एक बेबी जब 6 महीने का हो जाता है उसके बाद से आप यूज कर सकते हैं. फिर आपको रेगुलरली एंड रिलीजियसली यूज करना है, स्पेशली आफ्टर अ सर्टेन टाइम, जब आपका स्क्रीन टाइम बहुत ज्यादा होता है या आपका सन एक्सपोजर बहुत ज्यादा होता है. वो एक एंटी एजिंग प्रोडक्ट भी है, वो रोज तो लगाना ही है. रीएप्लीकेशन भी बहुत जरूरी है. ऐसे में मुझे लगता है कि हमारी लाइफ में कोई सबसे ज्यादा प्रोडक्ट अगर हम अपने स्किन पे यूज कर रहे हैं तो वो सनस्क्रीन है. कई लोग ये जानना चाहते हैं, डॉक्टर, इज इट सेफ टू यूज सनस्क्रीन फॉर दैट लॉन्ग, फॉर सो मेनी टाइम्स इन अ डे? इज इट सेफ? इज इट absolutely toxic free? What's your say on that?
Yes, it is safe. There's no problem in using sunscreen daily. But if you are having some skin conditions like burns, or if you're having fissures or open wounds or on your face, in those conditions you can avoid the sunscreen because उसका absorption एकदम जल्दी हो जाएगा body के अंदर. But otherwise, they're safe.
और जैसा आपने कहा, फिजिकल सनस्क्रीन तो है ही. अगर आप केमिकल
Yes.
सनस्क्रीन से बचना चाहते हैं तो आई थिंक फिजिकल सनस्क्रीन इज अ वेरी
Physical sunscreen is the solution.
Right. Okay. So I'll take one more question from Vaishnavi. Are there specific SPF or broad spectrum requirements for sunscreen to effectively manage rosacea?
Nothing particular for rosacea. 30 SPF is even if you're fine enough if you're indoors, and if you're going outdoors, 50 will give added protection, which is important.
Right.
50 will be better for rosacea patients.
ओके डॉक्टर, कई लोग हैं जो स्वेट बहुत करते हैं. बहुत से लोग हैं जिनको पानी में बहुत जाना पड़ता है, फॉर एग्जांपल स्विमर्स एक्सेट्रा. बहुत सारे एथलीट्स हैं जिन्हें अंडर द सन बहुत ज्यादा मेहनत करनी होती है, हार्ड वर्क करना होता है. दे आर कंटिन्यूअसली स्वेटिंग. ड्राइविंग की भी अगर मैं आपको से बात करूं, जो बहुत लंबे लंबे ड्राइविंग कर रहे हैं धूप में, कई बार उनका एक साइड जो ज्यादा एक्सपोज होता है वो काफी उसमें छाइयां या झुर्रियां पड़ने लगती हैं. इन सब के लिए, स्पेशली जो स्वेट बहुत करते हैं, पानी से जिनका बहुत ज्यादा नाता रहता है, वो क्या करें? किस तरह का सनस्क्रीन यूज करें?
For that thing, you have to look for the sweat resistant property in the sunscreen. It should be water resistant. अगर वो वाटर रेजिस्टेंट है तो अराउंड 40 मिनट तक के वो आपको अगर आपका मतलब पसीना भी आ जाता है और आप स्विम भी अगर कर रहे हो, for 40 minutes it will give you protection if it is water resistant. There are also very water resistant sunscreens or the waterproof ones. They give thoda longer duration ke liye they give you protection. So you can look for the water resistant property. And the second thing you asked for the drivers. Yes, from the even if your windows are closed, the UV light is coming inside. Sunscreen is equally important here also, even if you are driving inside the car.
Right. And sunscreen for oily skin or acne prone skin, because
You can
already
go
इतना
for
ज्यादा
the
oil secretion होता है तो वो बड़े worried रहते हैं.
gel sunscreens you can go for. Gel formulations you can go for that.
Okay. And doctor, before we sum up the session, any take home message or anything that you would like to say before we conclude?
Okay, so today is the International Sunscreen Day. On the occasion of that day, I would just tell you that use your sunscreen wisely, properly, and regularly. That's it I can say. It is very important according to the dermatologist point of view.
Right. So application, reapplication, choosing the right sunscreen as per your skin type and as per your working conditions. And definitely for all this, you can go and seek advice from a qualified dermatologist. Don't go for quacks. Don't go for influencers. Please save your money, save your energy, save your time, save your skin, and go to the right person, which is a qualified dermatologist. Thank you so very much, Dr. Pranita Dhillon. It was wonderful talking to you. Thank you for your valuable time.
Thank you so much.
It was great to hear you, and we really look forward for many more such sessions for our viewers in coming times with you.
For sure.
And viewers, thank you for your active participation in today's session. Stay connected to our beautiful Spotless Skin page. Thank you. Stay beautiful, stay spotless, keep glowing. Good day. Goodbye.